In a world where prescription drugs are meant to heal and alleviate suffering, we explore the most dangerous prescription drug recalls that have shaken the very foundation of medical practice by unearthing the stories behind the recalls that sent shockwaves through society. From unsuspecting patients to ethical dilemmas, this is a tale of caution, lessons learned, and the pursuit of a safer future. Let's take a step back in time, exploring the moments when the curtains were lifted, revealing the true faces of these dangerous medications. From the heart-wrenching tragedy of Vioxx, whose recall sent shockwaves through the pharmaceutical industry, to the controversial and deadly effects of fenfluramine-phentermine, we unravel the intricate web of events that led to these prescription drugs being pulled from the shelves. But this is not merely a story of doom and despair. It's also a testament to the power of vigilance, accountability, and the collective effort to protect the health and well-being of patients. Join us as we delve into the untold stories of lives forever altered and battles fought to ensure that such tragedies do not repeat themselves. So, fasten your seatbelts, for what lies ahead is a gripping report of danger and resilience, as well as case studies from those most affected by those medications. Welcome to the most dangerous prescription drug recalls in history. Here's a drug that rocked the pharmaceutical industry and raised serious concerns about patient safety. We're talking about Vioxx, a drug that was heavily prescribed for the treatment of pain and inflammation, until it was abruptly recalled. So, what made Vioxx so dangerous? Let's explore. Vioxx was introduced to the market in 1999 by Merck & Co. as a non-steroidal anti-inflammatory drug, otherwise known as NSAID. It was specifically designed to alleviate the symptoms of osteoarthritis, acute pain, and menstrual pain. Initially hailed as a breakthrough, Vioxx quickly gained popularity among physicians and patients alike. However, the trouble began to unfold when studies started raising concerns about the cardiovascular risk associated with Vioxx. Several clinical trials and epidemiological studies suggested a link between long-term use of Vioxx and an increased risk of heart attacks and strokes. One of the most notable studies, known as the Vigor trial, compared Vioxx to naproxen, another NSAID. It revealed that patients taking Vioxx had a significantly higher risk of experiencing a cardiovascular event compared to those taking naproxen. This raised alarm bells within the medical community and sparked further investigations. As more evidence emerged, concerns grew stronger, prompting regulatory bodies and medical experts to scrutinize the safety of Vioxx. In September 2004, Merck voluntarily withdrew Vioxx from the market after a large study known as APPROVE, the Adenomatous Polyp Prevention on Vioxx, found that patients who had taken Vioxx for 18 months or longer had an increased risk of heart attacks and strokes. While some patients were terribly affected by the symptoms posed by Vioxx use, others heavily depended on its ability to mask the constant pain characteristic of arthritis. Take Joanne Diliberto, the manager of a hospital coffee shop who had been taking Vioxx for almost 2 years to alleviate her painful arthritis. When Vioxx was taken off the market, Diliberto, along with 2 million other arthritis sufferers who relied on Vioxx, understood the controversy surrounding the drug, but still helplessly waited for a substitute to manage the pain and maintain a normal life. The Vioxx case had a profound impact on patient safety and drug regulation. It led to increased scrutiny of other COX-2 inhibitors, stricter regulations on clinical trials, and greater transparency in reporting adverse events associated with drugs. It also resulted in a wave of lawsuits against Merck, with the company eventually paying billions of dollars in settlements. Initially hailed as a breakthrough drug, Baycol, otherwise known as rosuvastatin, quickly descended into infamy due to its association with severe muscle toxicity and a high risk of a rare but life-threatening condition known as rhabdomyolysis. This dark chapter in the history of pharmaceuticals raises important questions about drug safety, regulatory oversight, and the ethical responsibilities of pharmaceutical companies. One of the primary factors contributing to the controversy surrounding Baycol was its association with the alarming high risk of rhabdomyolysis. This condition involves the breakdown of muscle fibers, leading to the release of toxic substances into the bloodstream. Rhabdomyolysis can cause kidney damage, organ failure, and even death. The accumulation of evidence linking Baycol to life-threatening side effects led to a heightened public awareness and a sense of betrayal among patients and healthcare providers who had put their trust in this cholesterol-lowering medication. Douglas Shaw filed a lawsuit against Bayer Corp, the company behind Baycol, claiming that they engage in false and misleading advertising for their cholesterol drug. Many other people also filed suits against Bayer after they withdrew Baycol from the market due to safety concerns. In the lawsuit, Shaw alleged that Bayer's unfair and deceptive marketing tactics led him to purchasing Baycol at inflated prices. Many people joined Shaw in lawsuits against Bayer as they believed Baycol was less effective, more expensive, and incredibly more dangerous than alternatives. The fenfluramine-phentermine combination, commonly known as fen-phen, ignited a firestorm of controversy in the medical and pharmaceutical communities. The once celebrated weight loss therapy quickly became a symbol of the dangers lurking within the pharmaceutical industry. The controversy surrounding fen-phen stemmed from its association with serious cardiovascular side effects, which ultimately led to its withdrawal from the market. Unfortunately, the lure of fen-phen cannot be understated in a society obsessed with achieving the elusive ideal of a slim figure. This weight loss drug combination promised a shortcut to shedding pounds. The rapid rise in its popularity mirrored society's insatiable desire for instant gratification, exemplified by the fad diet culture and the relentless pursuit of a quick fix. The controversy surrounding fen-phen escalated when reports started to emerge linking its usage to serious cardiovascular complications, particularly heart valve abnormalities. This revelation sent shockwaves through the medical community and raised critical questions about the safety of the medication. Heart valve abnormalities, once considered a rare occurrence, were now being associated with the very medication that millions of people had been consuming. Questions arose about the adequacy of the initial clinical trials and the failure to identify and communicate the potential risk associated with the drug combination. The legal battles that ensued served as a powerful reminder of the consequences when medication safety is compromised and the toll it takes on affected individuals and their families. Bruce Cooper made the decision to take fen-phen to aid in his weight loss. In a matter of months, he was able to lose about 30 pounds. He soon quit using the pills, though, because they seriously interfered with his sleep. Cooper learned about the recall of fen-phen in September 1977 through press reports, as it was thought to have been causing heart damage. He chose to have an echocardiogram done, despite having no symptoms or history of heart issues. Unfortunately, he was given a valve damage diagnosis, much to his surprise. Cooper's diagnosis considerably altered his routine. Every 6 months, he had to schedule stress tests and echocardiograms to check the size of his heart because of the valve damage's potential to cause the organ to expand. He had wanted to maintain a healthy lifestyle for his children, but now had to face this new health issue. The history of Bextra, otherwise known as valdecoxib, a non-steroidal anti-inflammatory drug, offers yet another cautionary tale within the realm of COX-2 inhibitors. Bextra was introduced to the market with great promise, touted as an effective pain reliever with potential benefits for individuals suffering from arthritis and acute pain conditions. As an NSAID aid, Bextra fell under the same class of medications as Vioxx, which had already faced significant scrutiny and subsequent withdrawal from the market due to its link to heart attacks and strokes. The safety concerns surrounding Bextra reached a tipping point when evidence emerged linking its usage to increased risk of potentially fatal skin reactions, such as Stevens-Johnson syndrome and toxic epidermal necrolysis. These severe conditions, characterized by the blistering and peeling of the skin, pose a significant threat to patient well-being. Allegations were made that Pfizer had engaged in deceptive marketing practices, downplayed safety concerns, and failed to adequately disclose the risks associated with Bextra. John Kopczynski was employed by the business until his termination in 2003. But even before he was fired, Kopczynski had been compiling information regarding Pfizer's promotion of the painkiller Bextra, which was ultimately withdrawn from the marketplace in 2005 over safety concerns. So what motivated Kopczynski to become a whistleblower? In his own words, it was about being able to live with his own conscience and seeing himself in the mirror. He first voiced his concerns to the firm over the aggressive commercialization of Bextra for applications that were not FDA approved. His worries were disregarded, though, and he eventually saw the company's ethical standards deteriorate. He was particularly troubled by the company's practice of paying sales representatives $50 incentives when they persuaded doctors to prescribe Bextra to surgical patients, even though the FDA had prohibited usage due to the hazards. Another unethical practice was pressuring physicians to prescribe excessive dosages of Bextra to patients, even up to 8 times the recommended beginning dose for some diseases. Kopchitsky was concerned about his employments, particularly because failing to actively market Pfizer's goods would result in his being referred to as a non-team player. So that's the story of the whistleblower who spoke up against Pfizer's unscrupulous spectrum marketing methods and won a massive $51.5 million reward for his efforts. Diethylstilbestrol, otherwise known as DES, stands as one of the most controversial medications in the history of medicine, as its tumultuous journey continues to reverberate through generations. Initially prescribed to prevent miscarriages and complications during pregnancy, DES left a devastating legacy marked by unforeseen health consequences for those exposed to the drug. Years after exposure to DES in utero, these individuals began experiencing a range of health issues, including reproductive tract abnormalities, increased risk for certain cancers, and infertility. One of the central factors contributing to the DES controversy was the failure to adequately assess the long-term safety of the drug. DES was approved by the U.S. Food and Drug Administration in the 1940s based on limited evidence and assumptions about its effectiveness. As affected individuals began to voice their concerns and demand answers, it became clear that the detrimental effects of DES extended far beyond the initial generation. The second generation, DES daughters, and third generation, DES grandchildren, offsprings of mothers who had taken DES, also experienced health issues. Lawsuits were filed against the pharmaceutical companies that manufactured and marketed DES, alleging negligence, failure to warn about the risk, and inadequate testing. The litigation also underscored the need for accountability and compensation for the individuals and families affected by DES. Listen to this 37-year-old lady who went to her doctor to express her concerns about fertility after trying to unsuccessfully conceive for 2 years. We'll call her Mary. She had consistent ovulatory cycles according to her basal body temperature charts, and her husband's semen analysis was within normal limits. However, her prior physician had commented on how oddly shaped her cervix appeared. Her mother had also gone through 2 miscarriages before the patient's birth. Mary showed up for the medical check in what seemed to be generally excellent health. However, the physician found a pseudopolyp on her cervix when performing the pelvic examination. The patient's history of infertility and the doctor's fear that she could have been exposed to the medication DES while still in the womb led him to schedule a hysterosalpingography and advise the patient to talk to her mother about the potential exposure. Mary's mother attended the follow-up appointment where the hysterosalpingogram had revealed that the patient's uterus was T-shaped. The mother dimly recalled taking medicine while carrying her daughter in order to avoid having another miscarriage. The DES controversy prompted reevaluation of the use of medications during pregnancy and highlighted the importance of evidence-based medicine and informed consent. The failure to assess its long-term safety, devastating health effects experienced by those exposed to the drug, and legal battles for accountability all contributed to the intense negative public perception surrounding DES. Must we not forget of the ethical responsibilities of healthcare providers and pharmaceutical companies to prioritize patient safety above all else. Thanks for watching, everyone. I had a lot of fun researching for this video, so let me know if you'd like to see stuff like this in the future. Reinvent the ordinary. Bye.